Gur mágad las ceann córa agus tá mé buíocht in dálas rud é gur ghlacamar leis an díospóireacht seo nach tá se na hábhachtach agus is súil agam nach díospóireacht é ach gur go aontaithe sa Dáil a nocht ag tacaíocht leis na vaccín, leis na hóirithe agus le muintear na tíre seo agus muintear an domhain a ghlach páirt sna tríal cliniciúla. I would like to speak today on the EU's coordination efforts on securing a vaccine against COVID-19. A safe and effective vaccine is our best chance to beat coronavirus and return to our normal lives. And as I've said time and time again, and I join with colleagues on this as well, and the vast majority of colleagues in this House, when a vaccine is available to me, I will take it, and I look forward to that day very much. But the European Commission has I think, what is now really an unprecedented response from a health perspective to the coronavirus pandemic. The European Commission and Member States have agreed on joint action at European Union level. The Commission has planned a centralised EU approach to securing supplies and providing support for the development of a vaccine. Funding for this has come from a significant part of Europe's emergency support instrument. The Commission has also worked tirelessly to secure doses of vaccines that can be shared with all on a fair basis. The European Union has worked closely with the pharma companies and the European Medicines Agency to ensure that not just an effective vaccine is available as soon as possible, but a safe vaccine is available as soon as possible. As with any vaccine, the vaccine candidates here have gone through and are going through rigorous scientific assessment before made available to the public. And I would like to thank each and every one of the participants in the clinical trials. I'm sure there were some in Ireland, but tens of thousands of people across the world who have taken on these risks that some people have said they're not willing to take, so that this can be proven to work and to be safe for the rest of us, and I think very successfully in this case. The European Commission, as I said, has entered into advance purchase agreements with individual vaccine purchasers on behalf of us all. In return for the right to buy a specified number of vaccine doses in a given time frame and at a given price, the European Commission is financing part of the upfront costs faced by vaccine producers from the emergency support instrument. The funding is considered as a down payment on vaccines that will actually be purchased then by Member States such as ourselves. The approach obviously decreases risk for companies, but it speeds up and increases manufacturing capacity. So the European Commission, again, on behalf of us all, it's our European Commission, has secured agreements with 6 vaccine developers so far, most of whom are now household names. The AstraZeneca, the Johnson & Johnson, the Sanofi, Pfizer, of course, CureVac and Moderna, and more may come. The recent positive announcements on the development of effective vaccines on COVID-19 and the conclusion of these arrangements is warmly welcomed, I think, by everybody in this House. All Member States in the European Union have access to vaccines at the same time, and distribution will be done on a per capita basis to ensure fair access. Indeed, yesterday the Commission President, Ursula von der Leyen, said that the EU's 27 member countries aim to start vaccinations at the same time, approximately, in a sign of unity. And I know that she had discussions with the Taoiseach about this the day before. In her statement to the European Parliament, the President of the Commission said that to get to the end of the pandemic, we need a take-up of about 70% of the population. This is a big task. Our medics and scientists have started the ball rolling, but it's up to all of us now to work together, individuals and Member States, to make sure that this happens. The European Medicines Agency regulates the release of medicines in the EU, is bringing forward to next Monday, as I understand it, a special meeting originally planned for a week later to discuss conditional approval for the Pfizer vaccine. It is true that European Member States have the option to go before the EMA under emergency rules, but I think the Commission wants a coordinated rollout across the European Union to ensure that nobody is left behind, and I think that that's an important principle, that everybody has safe access to this. The European Council, indeed, at its various meetings, and indeed the General Affairs Council, where I sit, have continually underlined the importance of preparation for the timely deployment and distribution of vaccines, including the development of vaccine strategies, that is the focus of the debate tonight, to ensure that vaccines are available to people in the European Union in good time and in a coordinated manner. This is exactly what the government has done with our own COVID-19 task force. And I want to pay tribute to the Minister for Health, Stephen Donnelly, to the Taoiseach for his leadership on this, and indeed to my good friend Professor Brian McCrath as well for his public service in this. I think that's extraordinary. I mean, Brian McCrath has, I think it's fair to say, transformed DCU. It is a world-leading young university, and I think that his skills are exactly the right skills that we need, of a friendly approach, a non-confrontational approach, but one that is grounded in scientific assessment, scientific reality and scientific method, and I think we can be absolutely certain of that from Professor McCrath. It is really important as well that we give as much clear information as possible on vaccines to counter disinformation, and I sincerely hope we don't hear disinformation in the Dáil tonight, and we don't hear insulting talk, I would say, about risks. There are always risks, but a greater risk has been taken on by many ordinary men and women in clinical trials who paved the way for the rest of us. The Commission will put in place a common reporting framework and a platform to monitor the effectiveness of national strategies, to share best practices. The conclusions of the first review on national vaccine plans will be presented in the second half of this month. And one thing I would say in terms of our European discussions, the Taoiseach would say this, I certainly say this from General Affairs Council, I know that Minister Donnelly would agree, that sharing of best practice from across the European Union, that sharing of experiences is very, very important, and I think plays a key role in what we're doing and is a key benefit of our European Union membership. But as I said, the arrival of vaccines doesn't mean the pandemic is over. The epidemiological situation in Europe is worrying. It's worrying in this country as well. But considerable efforts are being shown across the European Union. When I was in Brussels last week, there was not a soul on the streets after 10 p.m. at night. There's a curfew. Restaurants and bars are shut. Similar measures have been brought into Germany and the Netherlands and many other countries. So there is a dire situation at the moment in Europe that can only be relieved by the production of a vaccine. So the coordination of efforts at EU level have been really successful so far. I think Member States want to strengthen this as best we can. We want to, and everybody wants to, lift restrictions, return to normal travel. We want tourism back as the health situation allows. Vaccination, of course, should be treated as a global public good. It is no good if we all get vaccinated if some poor country in Africa, or indeed in some other part of Europe, is not able to avail of the vaccine. If we're not all vaccinated, or if we don't all have the opportunity, it loses, obviously, its effectiveness. The COVAX facility is a good strategy, but I think we need to keep working on that to make sure we live up to the ideals of that. Disinformation on the coronavirus is thriving. It's important to get updated information from authoritative sources only. HSE.ie, WHO.int. I would encourage everyone to follow the public health advice. This is based on scientific rigour. It is based on huge experience. And it is also based, let me say, on a hugely successful science behind vaccines over the last century or so. Because when someone questions vaccines to me, and people are entitled to question vaccines, I question polio. Where has polio gone? By and large, it's other illnesses, smallpox as well, has all but disappeared. All these illnesses that were debilitating and killers over many centuries have been eliminated or much reduced because of vaccines. I was very proud to stand up for the HPV vaccine throughout its history. And while I certainly met concerned constituents, one quick conversation with Professor John Crown about the dangers of cervical cancer certainly corrected any misapprehensions that one may have had. And we can actually look forward to a future without cervical cancer and other similar diseases that are impacted by the HPV vaccine in future because of the rollout of that particular vaccine, which at the time was much sought after and campaigned for by tens of thousands of Irish people. So I'm a proud supporter not just of vaccines, but of science, scientific method, scientific reality. And not all of these vaccine candidates are going to get approved by the European Medicines Agency, but many of them will. But what we can rely on are testing, scientific method, challenging all of the assumptions, and making sure the vaccines that are on the market are safe and effective, and they put an end to the pandemic. And I was surprised, I have to say this, because I have huge respect for the deputies in the Rural Independent Group, that while their motion yesterday at point number 2 was in relation to the reopening of pubs, and that is undoubtedly a significant issue. As I understand it in the motion yesterday, there was no mention of vaccines. You know, we're not going to get out of this pandemic and sort out all of the issues that it has brought on us unless we can get the vaccine rollout. And I would like to express also my solidarity and my support for families that have been grievously affected by this coronavirus. There are thousands of people in this country who have died. Their families have been left behind in many cases, and there are other people who are very, very sick still with ongoing issues, or who have had, I saw one case where someone had an amputation as a result of coronavirus. It is a very, very serious illness, and we've got to stick together, do our best for the next few weeks, the next few months, till the vaccine's available, in order that we can eliminate this. But I really want to say, I think the solidarity that we have shown together in the European Union, working together, buying medicines together, getting a good price for that medicine, sharing scientific and practical expertise, that is a wonderful thing to behold, and it is of immense benefit to Irish and European citizens.